Hello, everyone. Thank you for joining us. My name is Brian Zimmerman, and I'll be your moderator for this session. Before we get to some introductions, I'd like to start with just some tips on how to participate in this session. So please use the Q&A box to enter your questions for the speakers. At the conclusion of the presentation, we will discuss some of those questions with the panelists here. To engage with your fellow attendees, please use the group chat feature. If you experience any technical issues, please email support@mig.cc for assistance. All right, let's begin here. So operating rooms in hospitals are no longer solely entities providing patient care. They're also rapidly becoming data and IT businesses. The two types of businesses are becoming increasingly intertwined as hospitals, along with the rest of the modern world, leverage the power of data to support and improve their primary missions. Healthcare is digital and will continue to become more so in the future. In this breakout, we're going to discuss how data and digital are integrated into their health systems and what are the benefits and barriers to digital integration, and how this data is analyzed and shared for maximizing impact on patients and caregivers. So we're going to start here with some introductions. Pam, why don't you get the ball rolling here? About 20 seconds each.
Sure. Hi, my name is Pam Hamre. I'm the Vice President of the Robotic and Bariatric Service Line for HCA Houston Healthcare. I'm so located here in Houston. I cover a 15 hospital robotic program from Houston to Corpus down to South Texas.
Excellent. Thank you for being here, Pam. Dr. Belizon, why don't you go next?
I'm a general surgeon and colorectal surgeon in Boca Raton, Florida. I'm also the director of robotic surgery training for the residency program at Florida Atlantic University. And I am the associate director of the colorectal surgery department at Boca Raton Regional Hospital. Have a busy practice, including a significant amount of robotic surgery. And it's a pleasure to be here and an honor to be part of the panel.
Excellent. Thank you for being here, Dr. Belizon. And Dr. Ghazi, why don't you round off our introductions here?
Yeah, thank you, Brian. I'm Ahmed Ghazi, and I am an associate professor of urology and oncology at the University of Rochester Medical Center in Rochester, New York. We're one of the first few centers that actually started doing robotic surgery in Western New York. We run a very busy practice for robotic surgery. I am the director of simulation training and research, and also director of the Endourology Robotics Fellowship there. Very excited to be part of this panel because I think the future of surgery in general is going to be one that is filled with digital and data sciences.
Thank you, Dr. Ghazi. And now that we've sort of set the stage with your backgrounds here and our attendees can appreciate your perspectives, let's go ahead and get to some questions. So the first question I have for each of you, really, I'd like to hear all of you weigh in on this one. What role does data play in healthcare? How can data help? What is the value of data to you as a surgeon or an administrator? Dr. Belizon, you want to kick us off here from the surgeon's perspective, maybe?
Absolutely. Well, I mean, I think we're witnessing a revolution when it comes to data in healthcare. I think that a lot of historical decisions were made based on just what everybody thought was true or what might have been assumed as true. But now that data is playing a much bigger role in many areas of medicine, it's definitely becoming front and center when it comes to robotic surgery and surgical training. I think it's power, and when you have data, when you have that information in your back pocket, you're able to demonstrate that you're doing the right thing for your patients, that you're actually performing in an efficient and a correct manner, and you can actually support the decisions that you're making on a daily basis. So I think both from a healthcare economic standpoint, as well as from a training standpoint and decision-making for patient care, data is really the ultimate piece of information that should be driving and will be driving our decisions in the future.
Thank you, Dr. Belizon. Dr. Ghazi, do those comments resonate with you? Can you build on that a little bit?
Definitely. Data has been part of healthcare, ever since we were, writing up scripts and actually had those paper notes. The advantage here is, ever since we put a computer between us and between the patient, we are able to digitize that data. So the data is just more accessible. And, we are beyond the age of information where data is available. Now we're in the age of processing and analyzing that information using, AI and machine algorithms. So the idea is we have a wealth of data that is available to us, whether it's related to patients or related to actually surgical care. The idea behind this is how do we utilize this data to best benefit the patient and the surgeon as well as the operating team? I think that is where there is going to be a struggle for us to figure that out, because the data is available, the data is there, it is accessible. It's how we utilize it and analyze it to best benefit all parties involved.
Right. You have the data, you have sort of the raw material, so to speak, and now it's really about taking that and building something with it. Pam, I certainly want to loop in the administrator's perspective here as well.
Yeah, from my perspective, and I'll kind of piggyback off of what Dr. Ghazi and Dr. Belizon said, access to data is instrumental nowadays. It's what drives our business planning. It's what drives a strategic plan from a growth perspective. In my role from an administrative level, it also helps us understand where do we have opportunities for standardizing some of our OR processes. From a cost perspective, how do we measure up against national best practices, as well as how do we measure up amongst ourselves across our division as well as the enterprise. We use in our division data to really understand from a growth perspective, what is our utilization rate on our robots? Are we coming up against, pain points from an access perspective? Well, that data and understanding how to utilize that data and how to access that data has really been instrumental in investment planning as well as strategic direction. And it's also helping drive some of our conversations with different payers and employer groups to better understand the cost-benefit analysis of robotic surgery.
Thank you, Pam. In a moment, I want to get to some specifics around technologies, what's being integrated now and potentially in the future. But I think, now that we've sort of established the value of data and the comments from Dr. Ghazi and Pam sort of on how you make that accessible, right? I'm curious if we can dig in a little bit here and really talk about that accessibility piece. How do you make it accessible or actionable would be another word that we could use to describe this situation. Pam, do you want to get the ball rolling on this question?
Sure. So from a data perspective, we have built within my division, we've built with the help of our data analytics teams, a number of different data tools to help the facilities. So we have a robotics dashboard that's robotic data specific. And we have two arms of dashboards, one that's very financially driven and it's a financial analysis toolkit. And then we have another one that is solely dedicated to OR processes and best practices. So we're able to dive into this data to understand, what do our first case on time starts look like and who's the barrier? Is it the patient? Is it the surgeon or is it a staff member? And understanding, utilizing that data and putting it in the hands of people who can make impact. So OR director and hospital leadership, so that they can dive into this to really understand where can we continue to improve and create an OR of choice for our aligned surgeons. In addition, we've really created some toolkits for our facilities to really help them understand where to access the data that we have. And so that's making it meaningful and actionable data so that folks who are at the front end of our service lines, be it the robotics coordinator, the OR director, or facility leadership, have access to the data that they need in order to really drive conversations with surgeons as well as at a local facility level from an operations perspective.
Thank you, Pam. Dr. Belizon, Dr. Ghazi, I'm curious if you can speak to sort of like the data and the clinical decision component of this. How do you really make that accessible and actionable? We could have you both weigh in on that. Dr. Belizon, do you want to go?
Sure. It's been a really a revolution, a game changer when we started using the My Intuitive app that started recording and basically showing my data that's in my back pocket. I'm able to demonstrate to both administration and to my colleagues of what I'm utilizing on a regular basis, how I'm making myself more efficient, even to myself, probably most importantly, how can I treat my patient in the most efficient and best manner possible with the best outcomes for the least cost. And it's not just a guessing game like it used to be. I appreciate what Dr. Ghazi said, which was that data was always available, but like he said as well, it wasn't always accessible. And my experience with administration in the past, or with other colleagues in the past, that a lot of it was anecdotal and a lot of it was poorly supported if you actually delved into the data and did the research yourself. So this new device, that the new recording of my procedures and my utilization and the time that it's taking me to do procedures on a regular basis and in real time is priceless for me on multiple levels. And I'd love to go into it a little bit more, perhaps in a different segment, but it just demonstrated to me how important it is to have this data that is accessible, that is accurate, and that can demonstrate what best practices really are.
Yeah, great point by all the panel, and I will take it from the perspective of training, being in an academic hospital that trains a significant number of surgical trainees. For example, My Intuitive app is something that gives you a dashboard for every single one of these trainees. And even before My Intuitive app, we had a third party that used to, grade videos and even look at data and try in some ways to approximate where this trainee is and what parts of the procedure they have done before and what parts they are actually competent at. The idea now is we need to integrate all this, right? We can't have like 3-4 different types of third-party vendors that are giving us data. Integrating all of this into one app and into one dashboard, provided by the provider of the robot itself, is going to be instrumental in us kind of syncing across all this. It's like, you have an Apple Watch and you don't have a MacBook, right? And the idea is they don't sync together. They don't share the data together. So the idea of having one single platform that is able to give you data regarding instrument usage, number of procedures, metadata regarding the performance, being able to grade how well they are progressing, is instrumental in us providing the best care for not only our patients, but if we don't train these generations of future surgeons, we won't have anybody to be able to do surgeries in the next couple of decades, right? So the idea is, it is very essential for us to train the next generation to integrate all the data that is available, rather than just develop these opportunistic, kind of times where they are able to train. So I think we can train better using this data.
Something I was struck by there is sort of the mention of all the people that need to get their hands on the data, and whether it's through the app or through a dashboard, it just seems so critical that you're getting the right data to the right person at the right time, right? Dr. Ghazi, are these apps and dashboards, is that sort of how this is happening, or how else are you thinking about really making sure you're getting the people the data they need at the right time?
So that's a great question, Brian, because that's a big issue that we're dealing with in healthcare, right? Data should be definitely given to the user so that the user understands what type of data is there. But if you're giving the data to the user and the user is not kind of acting on that data, then it's invaluable. So there needs to be a hierarchy through which this data can travel. Whether it's, for example, the number of complications that you have per year in a certain procedure, it has to be shared with the administrator of the hospital, has to be shared with your chairman. We as surgeons don't like to be evaluated, even if we're training, right? Even when we're getting trained. That is a big barrier that we have to overcome. But I always tell people, don't use the word evaluation. This is, professional development. You have to know how well you're doing, what your positive surgical margin rates are, how well you're having patients perform a certain part of the procedure, and the outcomes that you're looking at. And several publications have shown that surgical skill correlate directly with outcomes. So I think it's very important for us to be able to develop a hierarchy or guidelines, how this data is traveled across the hierarchy of the healthcare system. And that's something that we need, people that are involved in the administrative component, in the surgical component, in the training component, to come together and decide on these so that all of us are governed by the same rules.
If I may, I couldn't agree more. I think that first of all, for a surgeon, nothing motivates a surgeon more than seeing things that he's monitoring on himself not going as well as he thought it was, or not exactly the way he envisioned things to be going. And I myself have made changes in my own practice based on the data that I was presented about me, about my procedures. And that could be a big drive for change and a big drive for better patient care and more efficient patient care when it comes to surgery. And then I want to reinforce the point that Dr. Ghazi made about training. The same thing is true about the residents. If they believe that they're evaluating themselves, if they believe that they're looking at their own performance and they're giving themselves the feedback, they're super motivated to be the best that they can be, and they're going to make changes appropriately moving forward so that their care and their skill improves accordingly. So there's no question that recording your own data, monitoring your own data, having that in your back pocket it just makes things so much more valuable and can really impact patient care pretty quickly.
If I may add to that, so to Dr. Ghazi's point about kind of a governance structure and chain of command, if you will, from a data perspective, I think this is where treating robotics as a service line is instrumental to, bringing all this together under one umbrella. So within my role in our division, we've done just that. And we've built and emphasized the need for having a service line structure at every facility. So there is essentially a chain of command. There is an executive lead at every facility who is the point person for robotics, with dedicated folks within the OR who are dedicated to the robotic space. And this provides, they're the owners of the data for their local facility. But then from my perspective, working with the local facilities to really understand what can we do to drive impact and change across the division. So one example of that, and to Dr. Belizon's point of, active surveillance, I think is a really good trigger for change within anyone competitive. And we've seen just that. We've created more meaningful meeting series with our surgeons to share de-identified data of theirs compared to their service line group. And I think there was a little bit of timidness to do that up front, but what came from this was a lot of active conversation. For example, someone would say, well, why is my cost this much higher than, doctor number 4 on the list when we're the same specialty? From a length of stay perspective and across the board, as you provide any of this data and kind of share it. And I think that for data transparency is instrumental in making impact and change from a cost perspective, from a patient care perspective, and then certainly from a training and skills perspective with the surgeons aligned with each facility.
Thank you. And as we know, surgeons aren't competitive at all. So it's, getting them that kind of data real time, you hope it makes an impact, right?
It definitely does. Definitely does.
I want to drill down now and sort of talk about some of the digital integration of some of these platforms you've worked with into the OR. Dr. Belizon, I want to start with you here, perhaps. So what has been the impact of the My Intuitive app? I know you mentioned this earlier, but can you talk about what the impact has been for you and in sort of both your roles there at Florida Atlantic University and Boca Raton Regional? What maybe were the barriers through which you had to coach folks to get through? Can you just share your experience with our audience today?
Yeah, I'd love to. So I think that the impact has been threefold. The impact's been, number one, on my own performance and my own efficiency, best practices and what works and what doesn't work. I'm able to review things a lot more accurately and make decisions based on accurate data that will be replicated and be consistent. But the two other points that it's really made an impact is what we've discussed until now is training residents, showing them in real time. It's not me. It's the data. The data is showing that because you did such a one thing versus another thing, the procedure went an extra 60 minutes, or because you decided to use an instrument, the cost of the procedure was significantly higher than it could have been if you would have eliminated an instrument that wasn't necessarily absolutely required. So, and then the third component is talking with administration with no comparing apples and apples. A lot of times, and I'll make the exception with Pam here, and I actually wish Pam was my administrator at this time, based on what she just said and discussed. But a lot of times administration will come and without any real accurate evidence or data that the cost of what I'm doing is higher than it would have been if I did it in a different fashion, or if I did a procedure using different technology. And very often they'll have little to no data to back up what they're saying. Certainly not long-term data like length of stay and the whole picture. Having that ability to discuss that intelligently and accurately with the administrator makes the discussion a lot more collegial and a lot more evidence-based, and may draw very different conclusions than at the beginning of the conversation. I'll give you one short example. When I started using my Intuitive app, one of the representatives pointed out to me that about 4 or 5 years ago, my operative time significantly increased, and basically just posed the question and said, why is your operative time longer now than it was 4 or 5 years ago? You've been doing robotic surgery for over 10 years. Why would it be that it's getting longer? It should be getting shorter. And I obviously agreed with him that that was a very reasonable conclusion. But it turns out that 4 or 5 years ago is exactly when we started our residency program. And that certainly impacted our ability to operate as efficiently as we did when we weren't training residents. So it just basically gave me another piece of evidence to demonstrate to the administration and to the executives making the big decisions in the hospital that if you want us to continue to be able to train residents, you're going to have to accommodate this inherent inefficiency or inherent increase in time. And perhaps we need an extra robot, or perhaps we need some other solution to increase the efficiency or decrease the cost that the resident training may be incurring. So there's a lot of ways that this has impacted us, but mainly those 3 ways have been the primary impact that I've noticed. And I'm sure as the technology advances, that impact will increase and will be in many other areas as well.
Thank you for sharing that concrete example, Dr. Belizon. I think that helps folks contextualize things a bit more. Dr. Ghazi, can you talk about your experience with the My Intuitive app?
Yeah, so I've started using the My Intuitive app just very recently, and it's something where I thought, basically I was using the same instruments for the same procedure, and there have been introduction of several other instruments, from the company itself that cost a little bit more than what you're utilizing. And they are, for example, seal better or are able to do a step more efficiently, but they take maybe longer or cost a little bit more. And then looking back at My Intuitive app, when you adopt that technology, you realize that you're actually saving costs on the back end, right? Patients able to go home earlier. You're able to have less complications related to this type of a procedure. You're getting less trauma to the tissue, which translates into post-op pain. So there are these parts that you can see where you can say, yes, this increased, for example, your cost, but it also decreased your operative time, right? So My Intuitive app allows you to balance that out, but it also allows you to compare among surgeons, right? Surgeons kind of believe that your technique is your technique and it's something that you feel very comfortable with. And then you start looking over your shoulder to your colleague who is using an instrument that is maybe not perfectly made for this step of the procedure, but it enables them to prevent an instrument change. One of those things, for example, is the forced bipolar, right? Is the bipolar that allows you to hit the pedal and use it as a needle driver. So you save an entire needle driver to use during the procedure. And it also, not only that, it decreases the need for you to change an instrument in the middle of a critical part of the procedure, like a partial nephrectomy. So as a result, although it initially costs a little bit more, it's actually saving you on the back end, but also saving you time in a critical part of the procedure. That you can only know from looking at something like My Intuitive app, right? Because it tracks your performance, it tracks when you change things, but also something very important in my aspect of research, because we look at operative times or outcomes that are related to whether the resident or the attending, the faculties on the console. Now it's an easy shift where My Intuitive app, as long as you log in, to say these components of the procedure are performed by the trainee and these components are performed by you. So it's a very useful tool for tracking their performance and really looking at which part of the procedure is performed by who.
So in addition, as Dr. Belizon sort of pointed out, it helps collegial sort of conversations between administrators and surgeons. It also helps sharing best practice or efficiency improvement between surgeons too, right?
I wouldn't say it changes your mind right there and then, but data is data. This is the power of data. Right? You look at something, you might be denying it right there in the middle when they're telling you it, but in the back of your head, you know that there's some truth behind that. It starts to brew, and then you see that you start to change practices. Right? This happens every time we go and attend a conference. We see other people doing other things. They say their outcomes are better. We come back to our institution and we adopt that. We like it. We move forward with it, right? So this is happening now on a monthly or weekly or maybe even on a daily rate.
Right. Data is data, as you said, and sooner or later, you got to reckon with that data. Like you've got to come up against it.
Solid way of winning the conversation, right? There's no, in my opinion, it's not there anymore. It's in the data's opinion that this is what.
Even a surgeon has to admit that.
Yeah. Right on. Pam, I want to get your perspective on this too, on the My Intuitive app. What's your experience been like?
Yeah, no, I love hearing it from a surgeon's perspective. Within our division, we only have a handful today that have received the My Intuitive app, so it's still being rolled out across some of our surgeons within our division. But what I've seen this do already, and what I think it will continue to do as we get more hands on the MIA app, is this creates a two-way street of communication when it comes to data and impact for both the practice and patient outcomes, but as well as from a facility kind of operational perspective. So we at the facility level, of course, have our own data that we share with the physicians, but now it's bringing them to the table with their own data to say, well, here's what my data shows, and here's where, potentially there's opportunity from a cost perspective or from a console time, or, even interestingly enough, within our GME programs, I'd love to get my hands on some of the data to better understand, what is the delta between a GME program versus a non-GME program for a specific case. Because, I think that's variable depending on who the trainee is and things of that nature. But I think that sort of data really helps drive better calculations of utilization. We're not comparing an apple and an orange anymore with a GME program to just a practice full of, private or employed physicians. This is two very different things, and they need to be treated to some degree differently when it comes to looking at their data to see, who has access and who needs additional access at their site.
Thank you, Pam. And then I want to dig into your experience here as well. You've managed robotics, as you mentioned, across a 15 facility organization down there in Houston. Can you talk about what the impact of your team's data analysis and assessment program across all those facilities has been?
So, yeah, sure. So we have, like I mentioned, our data analytics team has built dashboards, but what has become more useful, at least for me, is taking the data within those dashboards to create my own separate dashboard and sharing that data to really make it meaningful. It has helped, for instance, as we go into business planning season and looking at future investments, it really drives the conversation with the facilities around what are true growth opportunities or what are actual just operational roadblocks that need to be assessed. And so I sit down with the facilities and have this conversation. From a growth perspective, it's how do we create an OR of choice and a best practice sharing amongst all facilities, but also implementing and continuing to improve our turnaround times and things of that nature that we know are impactful to the surgeon. But then also at the same time, if we are looking to grow, prioritizing. We have 15 facilities. Not every facility is going to get a new robot at the same time. And so using our data to understand from a priority perspective, who's next in line and who has opportunity to maybe tweak a couple of things in their block utilization or other to create a little bit more space to take them through the next couple of months.
Thank you. And My Intuitive app and Orpheus are projects that are still pretty new for your organization. Pam, I'm wondering if you can maybe talk about, from an operational point of view, what you believe the impact of those applications will be in the long term, and maybe any, as you've initiated these projects, any maybe watch outs or barriers you've encountered that maybe folks watching this right now could benefit from hearing?
Sure. So like I mentioned, we're still rolling out, our key opinion leaders, surgeons within our division are still getting the MIA app. So we're still figuring out, who's up next, and, how does that data provide impact bidirectionally. But then from the Orpheus perspective, we're in the midst of rolling that out across our division. So I have 2 sites that are getting that in the next couple of months. And, yet to know the total impact that it'll have, but provided from conversations with a variety of surgeons, having access to your video clips, cloud-based, everything's cloud-based these days. So it's easily accessible, easy to trim, and easy to use from a patient perspective, if that's, if there's an opportunity there, but certainly from a training perspective, both with staff training as well as with new trainees from a residency and fellowship program. And so, from a lesson that we are learning along the way is, of course, as any new IT software system rollout takes place, there's always need for added data capacity and IT infrastructure capacity. So we're working through that right now just to really understand, if we were to roll this out across all of our facilities, how much data infrastructure will this need to support, these ongoing video clips that will now become a part of our regular robotics program. So we're still working through that. I think we still have a couple more weeks to get that all firmed up. But, I think the connection of the data that will come from there, and the video clips that will come and become easily available from there, will only further help and support our GME programs.
Thank you so much for sharing your experience there, Pam. Dr. Belizon, you want to weigh in here too, as to how you see these technologies evolving over time?
Yeah, I think. By the way, the MIA app, I actually, when I first got it, I thought it was the Miami app, but the app is so powerful. But I think Orpheus's potential is 10 times that, because in order to just like Pam said, in order to train someone to be able to demonstrate in real time or in review what I did differently, what techniques can be done that can possibly change the outcome or change the efficiency of the case, is a game changer. I keep saying that word, but it's really changed the way that the residents and the trainees are learning surgery, and to be able to help a colleague out in the middle of a case who's stuck in a sister facility or in another place in the country, and said, "Hey, take a look at this. What do you think I should be able? What do you think I should do in this situation?" And to be able to demonstrate give them real-time instructions in the middle of a case just expands my ability for patient care and helping out people, which is why I love what I do. And the potential it goes on and on in terms of how it could impact patient care and physician training. Not to mention my own review and my own ability to see what I've done and how I can change it, how I can improve upon it, is also invaluable. So in so many ways, the way that my Intuitive app has, in my opinion, revolutionized what I'm doing, I think Orpheus has the potential to do so much more, both for myself and for training. And I think the best is yet to come.
Thank you, Dr. Belizon. I want to ask one final question of the panel before we move to some audience questions. Dr. Belizon, we can start with you, then Dr. Ghazi, and any final thoughts from you as well, Pam, before we get to those audience questions. But my final question is, what is your expectations from a vendor or partner in digital integration in the OR? How do you come to those partnerships, and what are you really looking for? Dr. Belizon, we can begin with you.
Well, I mean, I think it all comes down to the same word, data. I think that that when a random pharmaceutical rep or manufacturer rep approaches me to try to get me to look into their product, my answer is show me the data. Show me what's been done and what research has been done, the studies that demonstrate the need or the improvement that your product gives me, and I'll consider it. And most manufacturers, if not a significant, almost all of them, don't really have that much supporting data to demonstrate the significant improvement right off the bat. And that, as a physician, makes me a little less comfortable and certainly more reluctant to adopt that technology. I think Intuitive has been amazing, especially in the recent years, of really being data-driven. And the My Intuitive app, Orpheus, all of these are examples of them wanting to just demonstrate in real time and with accurate information that we're trying to make patient care better. We're trying to make patient care more efficient. And there's no better way to do that than with the data that they're providing us.
Thank you, Dr. Belizon. Dr. Ghazi?
Yeah, so what I would ask from a vendor is complete integration, right? So one-stop shop, having all the data that is required of us to improve and advance patient care in one place, right? I don't see Intuitive as a hardware company. I see it as a software digital technology company. For example, we are the first site that started using what we call the Iris app. And just to give the audience an idea, it's an app that takes the patient's CT scans preoperatively, loads it into a secure PACS system, and develops a 3D reconstruction of what we have right now as the kidney with a tumor. And our goal is to only remove the tumor while controlling the blood vessels, preventing injury of surrounding structures, etc. This 3D reconstruction has given us immense amount of data and information preoperatively, as well as intraoperatively, because it's fused into the Tile Pro. The future is actually having it overlay on these structures, but also I'm looking for postoperatively. There are now algorithms that are able to take metadata in the robot and actually develop predictions of outcomes. This patient is predicted to go home the next day. These are the predicted complications. These are the issues that you should look out for, right? We should start to really not be surgeons that react, but surgeons that are proactive. I expect this patient to have this complication or this outcome, and therefore I should work towards it or keep my eyes open on it, right? Maybe a patient needs to stay an extra 2 days to prevent a readmission. So I'm looking for this complete integration where the company takes me from the preoperative assessment and planning of the patient to the intraoperative navigation to the postoperative prediction of outcomes. And with the data that is currently available in the actual Da Vinci robot, we're able to do all of this, right? And that's what I would ask from a vendor, a complete integration, one system that gives me through the entire trajectory of healthcare.
Thank you, Dr. Ghazi. Pam, any final thoughts from you before we take a couple audience questions?
Yeah, sure. So my kind of coined word for this would be partnership. I think Intuitive has done a phenomenal job of rebranding themselves over the last number of years from a sales-driven team to a clinically led-driven team. And so partnership within my local Intuitive reps and myself to really share data that they have access to that would only benefit my programs going forward. So for instance, we rolled out the extended life program about a year or so ago, and getting some of the data to show what impacted that drive at the local facility level and across our division. And so of course, that's a cost savings approach. Any effort we have to reduce costs from an overall healthcare experience for both the patient and the provider is one of our key strategies and focuses within the robotic service line. So really utilizing the data that Intuitive has access to really drive impact, both from an operational perspective and then alignment with our local team, our local surgeons.
Thank you, Pam. It's been a pleasure speaking with the three of you for this time. And now we're going to jump to some audience questions. We've had a bunch of great ones come in. So we got an engaged group out there. The first question I'm going to pose to the group is the attendee asks, have all of your care teams or staff been open to the visibility that a digital integration has brought? Dr. Ghazi, I know we talked a bit about it taking a little time sometimes for people to get there, but if you have any add-ons to this question or any of the other panelists.
They're open to it. I think the issue is not in the staff that is in the operating room. I think we carry in our pockets every day a computer system that allows us to have access to the entire world. So none of us are new to technology anymore. And we know it's going to penetrate into healthcare and into our daily lives and into our patient care to the utmost level. I think the issue is with administration, right? Administration is kind of a little bit set back by the fact that what this data will be able to provide, what benefit it will provide, but also what vulnerabilities it might provide in that process. And I think we have, firewalls and ways to protect the data, but I don't see a barrier towards adoption of the data. I think the issue is the cost of that data, the cost of analyzing the data, and the cost of being vulnerable to that data. I think those issues need to be addressed. And when they are addressed, then the staff or the surgeons themselves do not have any barriers to utilizing more and more technology. They're already using a state-of-art machine that allows them to do what they weren't capable of doing with other minimal invasive approaches. So I don't see them as barriers.
Yeah, on the contrary, I would agree. I think that it's actually enabled us to become more partners and have administration partner with us when they realize that the accurate data is demonstrating that there's major advantages to what we're doing. I know that the trainees are on board. They're adopting it. They want to see what their performance is in real time. They don't want to hear some senior attending tell them what they did wrong or what they did right. They want to see it in real time and in accurate data, and that impacts them so much more. So they're on board. I think administration, I'd like to think that most administrators are on the same page as we are, and we're all on the same team, and we all want what's best for the patient, what's best for the hospital. And if the data demonstrates that that's the case, I think they're on board as well. So I think all in all, the adoption and the integration of these data collecting applications, it was very positive, and I think will only continue to grow.
Yeah, and from my perspective, I've seen phenomenal adoption of data across our robotics programs. This is a service line that is, it's easy to capture the data. It's all within a piece of technology that then drives into different dashboards that are either ours locally or through Intuitive. And so I've seen data drive even surgeons who were naysayers to robotics. You showed them the data that, that really helped to drive them and pick up their adoption of robotics. I've seen significant growth even across our facilities from a process improvement perspective. Some of my best robotic programs are ones that track data showing time utilization from the minute the patient is rolled into the room to the minute they roll out. And they utilize this data to really understand what are some barriers that we have or what's extending our time within specific cases. And so I think this access to data and the accessibility of multiple folks is really instrumental in driving change.
Thank you, Pam. Thank you, Dr. Belizon. Thank you, Dr. Ghazi. Out of respect for everyone's time, we're going to have to call this session. It's been a pleasure speaking with all three of you. And thank you to all our attendees for joining us. You will now have a quick break before you get to your next session. Please do remember to complete the survey at the end of our time here. We are constantly looking for ways to improve. Thanks again.
Thank you.
Thank you.
Thank you.